Hey guys, getting ready to show up in here. Starting our mold and health question talk with microbalance. If you can hear me, let me know. Give me a thumbs up, making sure that we can all get going on there. Hey guys, thanks for joining in for our talk tonight on mold. Awesome. Somebody give me a heart or a thumbs up if you can hear me well. Awesome. Very, very good. Hi guys. Okay. So as we're getting started here, just letting people trickle in. Tonight we're going to be talking on mold, but I want to introduce myself a little bit. I'm Dr. Martin Hart. I specialize in mold illness. I work with patients on a functional medicine and biological medicine basis. Thank you for mentioning that, Mold Warrior. Appreciate it. Let me know. So that's my background. You can read my article on sinusitiswellness.com. They post that up for me. So as we're starting, I want to say thank you to Microbalance, number one, for making such great products that we love to use here in our clinic, but also for having me on tonight. Give me a chance to chat with you guys, answer some of your questions, doing all of that. So as we're starting and getting going, hey guys, thanks for joining in. Let's just first say that I want to let you know, talk is not meant to help you treat or diagnose mold illness. It's not a diagnostic setup. It's an informational, educational purposes only. All right, so it looks like we got quite a few people coming in, so we'll jump in with those questions. So people submitted some questions ahead of time, and that's what I'm going to start with tonight. So let's go with question number one. What kind of testing do you normally do in your patients when you suspect mold? This is a really great question. Hey, Matt, good to see you. So the testing I usually do when they come in, number one, two things. I want to test their home, okay, to make sure that to see if that's where they're getting a potential exposure. And so for that, a lot of times I'll use plate testing. I'll use the EC3 mold plates, or I'll use either the EMA or ERMI to see what sort of mold and mycotoxins are present. And that's what I do in the home. For the person, I'll do a urine mycotoxin test. There's a couple of great ones. Hey, Jen out there, nice to see y'all, that are good, that measure the number of mycotoxins in the urine. So you could look at one of those that we use. There's 3 or 4 out there that are really beneficial. And so we want to see, does the body hold mold toxins? And then you can get a little further and you can look at different biomarkers that are in the body. They're not direct mold markers, but they're typically elevated or decreased depending on what you're looking at with mold. So that might be a blood test on something like MSH, which is a hormone out of the brain, melanocyte stimulating hormone. You could look at VEGF. You could look at C3A and C4A, which are immune molecules that tell us about inflammation. We could look at things like osmolarity, which is how hydrated are you. That's actually a really easy one to do in the blood. You could look at ADH, antidiuretic hormone. It's another hormone from the brain that helps us maintain our water flow. So you can measure all these different things to say, okay, how is it affecting our body? And so you can look at it directly with a mycotoxin test, or you can look at it through a blood lab test. And the ways you can do this test is by typically working with a practitioner to do the body test. The home test you can order through the EC3 or the Microbalance website. So the plate testing and the EMA are all available there. But if you want to test your body in that way, you need to find a good qualified practitioner who specializes in mold illness to help you test those out. So hopefully that helps you. Those are really good intro ways to test and figure out, am I dealing with mold? Number one, test your environment. 2, test your body for mold toxins, mycotoxins. And number 3, you can test for markers to see what's going on. And that's also a really good way to measure progress, right? Is inflammation going down? Are the hormones balancing out? Are mold levels going down in my body? All really great ways. So next question here, jump in, is what do you do to start treating someone who can't leave their environment yet? This is a biggie because if you're in mold, right? If you're in mold, ideally you'd want to get out. So if you're living in the mold, kind of step one of my process is let's test your environment. And if we can, let's get you out of there. But sometimes you can't leave, right? So what can you do? Well, number one, you want to start supporting your body right away. Okay, you want to start, if you can bind up the mold toxins, you want to do that. Look at a good, healthy binder. You want to try to lower the inflammation. You want to make your internal environment as safe as possible. And on the external environment, if you absolutely can't leave until it's clean, there's a couple of good options. Number one, you'd want to change your HVAC filters at least once a month. Okay, so make sure you're getting those changed on a regular basis. 2, you want to get a really good air filter. Okay, you want to make sure it's smaller than, it can filter down to less than 0.1 microns. Okay, a HEPA filter that can filter down to less than 0.1 microns and get a lot of those mycotoxins up and bind them up. And you would want as many of those as you need to clean your living space. Okay, so there's some that'll clean a whole 1,200 square feet, for instance, and with one device. But if you've got multiple levels, etc., you're closing doors, you want to have enough air purifiers in your home, air filters, to clean that out. 3, you want to start using mold cleaning products. EC3 makes some great ones, all the way down from sprays and things to wipe things down, laundry additives to clear them out of your clothes, to the foggers. Those are big too. I highly recommend people fog on a regular basis if they know they have mold in their environment. So 2 things. So what do you do if you can't leave your environment right away? Number 1, make your internal environment as safe as possible. Get to mold binding, lower inflammation. And then 2, you would want to make the external environment as clean as you can, as clean as possible, right? So, and I want to make sure I'm really careful. If you've got like tons of black mold that you're seeing, do everything you can to find a way out, okay? So I just want to say, if you can get a way out of an environment that's just super toxic, you need to. If it's in the mold, it's in the HVAC system, you'd want to have it professionally cleaned. You got to watch out for cross-contamination there. And there is some ways to fog your HVAC system. Those are possibilities to look at there. And again, those you may need to use some professionals for some of that. If you're renting, and typically what I've had my patients and clients do is take the results of your mold test and potentially your lab test to your landlord. And oftentimes they will respect what you're asking them to do, but you need to make sure they do a good job, not just wipe it up with some bleach. Okay, they need to make sure that they're actually cleaning it up. And a lot of times they will be receptive. Not all of them, unfortunately, but many of them will be receptive to that. Third question coming in here. So we're doing really well so far. And thank you guys for submitting questions. We're going. That's great. So how do you use the EC3 products in your practice? So here at our clinic, number 1, I wanted a very simple way that I could have someone test their home, a very low barrier of entry, right? Sometimes mold testing can range anywhere from like $350 to a few $1,000s to have those inspections done. And so that can be overwhelming. And if initially when I was requesting patients do those sort of things, I would get so much pushback. They would deny the possibility of there being mold in their environment because they didn't want to deal with both the stress of the situation and the economic cost. And so EC3 with the mold plates, those specialty mold plates, those are a fantastic way for us to test the environment right away. Okay, and so it gives a really good indication of is there mold growing in my home? Now it's not an end all be all, but it's pretty good. It's fantastic, in fact, and you can go even further. So each of those kits comes with like 6 mold plates. You can test tons of different rooms. So you might know like, okay, the bedrooms, they don't grow much mold, but the basement and the laundry room or what have you grow tons. Okay, so we can kind of narrow it down. We know where the mold problems are most likely at. And so that's number 1. We use we go through a lot of the mold plates for that reason. I highly recommend if you test your work environment, you test your car. That's one that I started having patients test a lot more of is their vehicles. Some people's vehicles are disgusting. Okay, and I don't think it's any fault of their own. It's just mold grows easily. There's so much fabric in there. There's always in the weather. You don't think about leaving the window open in the rain, right? We'd expect it to grow in the house if there was a leak, but we don't think about the rain coming into the car, for instance, when you left your window open all night during a rainstorm. That's going to cause mold potentially. So you can use those plates to test your car. You can test furniture. You can test rugs. It's a really great way. So that's the first way. And then the cleaning products are a major one, number 2. So the laundry additive, the spray product to use to clean the environment, that's going to be a big route because even just dust comes in, things like that. You want to keep all those mold spores, all those mycotoxins low. Yeah, it's definitely left my sunroof open when it rained. Yeah, it's happened to a lot of us, and we dry it up, but we don't think twice about it. So you want to test and make sure, is there potentially mold growing in there? And you can use, as I'm talking about the other way I use the products, you can clean the car the same way you clean the house. And they are recommending ozone treatment after. How do you feel about that? Yeah, I'll talk about that in just a second. So ozone. So, but then the cleaning products, the cleaning spray is a big one we use, a laundry additive, etc. And a good one, I didn't mention this before, but it's a really good one because we do use the candles, okay? If you can't get out of a moldy environment yet, you want to use the EC3 candles because they do lower, third-party tested, they lower mycotoxins in the air, okay? You burn the candles, it's kind of nice, some ambiance, right? And it lowers mycotoxin content in the air. So that's a great way to do. We offer that for patients. That one's fantastic if you're traveling, right? If you're traveling and you can't tell if the hotel room potentially is going to have some mold or mycotoxins, bring a couple candles and burn them with you while you're there. So that's going to be big. So, and then the other way is the foggers. Highly recommend the foggers for people to use, especially like, let's say I have some patients who are very mold sensitive and their environments are pretty clean, like almost pristine. I still have them fog once a month or once a quarter to get it cleaned out. So that's a great option. Alternatives to fogging, or even, after fogging, like somebody asked, how's ozone? Ozone's another option to help kill and reduce the mycotoxins and mold content. You have to vacuum afterwards, wipe everything down and vacuum afterwards, but it's hitting it differently. I either fog or I ozone, right? They hit the things differently, different mechanisms of action. So you would then at that point, you could do both at different times, not together at the same time, different times. So we highly recommend in our practice the foggers to people with the EC3 solution. It works great. Many patients tell me how much better they feel after they fog. I had one recently who she was fogging on a regular basis and she'd feel good for a week and then the symptoms would come back. And so we used the plate testing to try to track down. She still had some mold in her house that she hadn't found before. It was under the countertops, I think. And so if I recall correctly, we use the plates to help us narrow that down. And you can keep testing. So treat, test with those plate system. That's a great way to do it. So a lot of times what I'll have somebody do, so get a kid or two, let's put out like 3 plates. Okay, it's moderately moldy. We think we know where it's at. Treat the area with a fogger, clean everything really well, right? Have the carpets cleaned or removed. Use all the EC3 solution to wipe everything down, fog everything. Wait a couple days and retest. Did you do a good enough job? So that's another way we use the products. Are the foggers safe for people with MCAS and MCS? Jen, yeah. So what I've seen for some of those people, if they may be a little sensitive to the spray, they do really well if somebody else, like they go out of the house for a few hours, somebody else fogs it, and then maybe vacuums or whatever and lets it time to settle. Even some of my most sensitive MCAS patients seem to do okay with it, with the laundry out of it, etc. Run it while they're not in the house or in a separate room, and then let it settle before they enter that area. It seems to work out really, really well for them. EC3 does have the new electrostatic fogger that I'm really excited about on that front, because instead of just fogging and putting a coat, the particles coming out of the fogger are charged, which means they're going to be attracted to surfaces. So they're going to better surround it. They're going to better grab onto things. And so it's going to get a deeper penetration and a further coverage than the other foggers. So it's a great one. What if mold's in the kitchen cabinets and you can't remove cabinets? I spray with EC3 every other day. So if you can't get the cabinets removed, you want to keep wiping them down, but at some point you may want to see if you could, like if it's growing in the wood or the material, if you could seal it some way. And then when you cleaned at that point with the EC3 solution, you get a better clean. But you'd want to create a barrier and trap it. And I want to say that is, kind of a similar caveat as like, this is not meant to treat or diagnose mold illness. It's educational, right? I'm not a remediation specialist. I'm a people mold illness specialist. So take that as an educational, informational aspect rather than like, hey, you need to necessarily go do this. But that's what I've seen work for patients and clients, is seal it and then you can clean it easier. So that's how we usually use EC3 products in our practice. I also use some, and this kind of ties into the next question, when and how to use homeopathy in your practice. And I'll tie this into the EC3 products and I'll expand that a little further. So EC3 and Microbalance, they also make some of the different products like Celltropin, for instance. I find Celltropin is a great way to start healing the brain and the pituitary gland when you're dealing with mold illness, mold toxicity, right? So I talked about how your brain secretes MSH, melanocyte stimulating hormone. That's really important for like tanning and our skin health, but it's also really important to balance our hormones and balance our immune system. And mycotoxins suppress that. Okay, it suppresses that out of like the pineal gland and the pituitary gland. And so afterwards, sometimes even when we detox, it doesn't always necessarily just click back on. We've got to do something with it. And something like Celltropin, I find, tests very, very well and works very, very well in the practice. And that's a version of homeopathy to help reset that system. So what is homeopathy? It's a high dilutions of different molecules. Okay, so in the Celltropin, there's some versions of like pituitary gland and things like that. And so what it's doing is it's providing information to the body. It's kind of like an informational reset, or sometimes I call it's like a coach. It's coaching the body on how to do these things. And as somebody's asking, they had a sinusectomy and mold removed. They also removed a lot of bacterial infection, probably some Marcons, I imagine. What's the best course for cellular healing? So I'll talk about that a little bit more. But if you've cleared the mold out, then what you also want to do at that point is you would want to do something like Celltropin to reset the actions of the mold. So what did the mold do? And then you want to reset those in the body. So Celltropin helps to reset the brain response. So we talked about MSH. ADH is another one, antidiuretic hormone. It plummets that. Mold lowers that really down. And that's why moldies end up urinating all the time. They're just peeing all the time. They're thirsty. It's because their ADH isn't holding on to the water. And so we need to reset that. So Celltropin is a great way to do that. Other ways I use homeopathy is basically when I want to coax the body into doing something gentle. So when I want to have the body do something without having to be too harsh. So someone who's really sensitive, or if they're having a hard time tolerating remedies and supplements, then I would have them do homeopathy. It's going to be gentler. Its mechanisms are going to be more on the subtle body of the field, the informational field of the body, rather than direct action. And I find they work very, very well. Okay. Research does show that homeopathy, like the base of homeopathy, is different than just plain water, and the ways you make the homeopathics matters. It creates different type of informational fields. And so there's some really good research on that front. But homeopathy I usually use, especially for detoxification, for resetting informational fields when I'm trying to reset feedback loops, for instance, from the brain to the pituitary gland to the adrenals. Like that's a communication feedback loop, and homeopathy is a great way to reset that. And so EC3 Microbalance has some great homeopathic options in that front. Celltropin's a really, really good one to reset some of the brain. I've seen that work great on resetting some of the immune aspect. Like I said, the ADH, the urine. It's really supporting the body in that front. Is the alcohol percentage safe in Celltropin? I have seen no issues with it. And then if somebody does struggle with it, we just simply evaporate it out, is what we do. So most folks don't have a problem with the alcohol, but if they do struggle with alcohol, like maybe they do have MCAS or histamine or alcohol intolerance, then we just evaporate it out. It's really simple to evaporate this out. So let's say your dosage of Celltropin was 2 sprays, okay, a couple times a day. What you do is you take a cup of boiling water, like you boil some water, put it in like a teacup or a tea mug, and then you put your 2 sprays in that tea mug, right in there, okay? Let me see. So it'd be like, get your boiling water, okay, got it in there, your 2 sprays, spritz, and then you let it sit until that water gets to room temperature. And that allows it to evaporate off. It's kind of like when you cook with alcohol. You're cooking the alcohol off. And then you just drink you slug it back. Drink the tea water at that point, the Celltropin water. And that's a great way to evaporate it out. Homeopathics are a great way to work with toddlers and kids too. So kiddos who maybe can't do high dosages of things or can't tolerate a lot of same substances, children, toddlers, babies, all do great with homeopathy. It works fantastic. Now, what's really neat is you can see it work in them. They have no idea what's going on, and they're getting better. So that's really neat to see with them. That is a great option. Okay, so somebody's asking about, and I'll just touch on this really quickly, the feeling like they need to pee all the time, but they don't have a bladder infection, it's been ruled out, but nothing comes out. That could be a lot of different things. But with mold illness, what I see is that the mycotoxins are typically either affecting the membranes, like the bladder membranes, or they're affecting the nerves, okay? So both of those have to be cleared and processed at that front. Frequent urination is a mold exposure side effect because of the ADH. It lowers the antidiuretic hormone, and sometimes it affects the aldosterone for the adrenal glands, and it makes you urinate a bunch. It makes it really hard. So for instance, at one point, mold was contributing to some of that for myself when I had some mold exposure, and it made it really difficult, for instance, to even exercise consistently. If I was to push it too far, I would cramp up all over. Well, why? Because I couldn't keep myself hydrated. So clearing that out makes a huge difference. And then resetting the ADH, resetting the brain afterwards, which vasopressin is ADH, but which celltropin helps to do. So when getting mold numbers down, can we start with cellotropic and homeopathy? Different reagents, I don't start with it, and I'll go over my process in a second. I don't start with celltropin. I usually start in a different route, and I'll explain why in a second. So, okay, I think that answers homeopathy quite well. Maybe too well, got it rambling there, but I love homeopathy. It's a fantastic method, worked for hundreds and hundreds of years. Okay, so a couple people asked a couple questions about, can mold cause smoker's cough? Well, at that point, it wouldn't be smoker's cough, right? It would be a mold cough, but it sounds just like a smoker's cough. You know, a lot of common symptoms I see with mold and people having mold in the home, sinus congestion is an easy one, right? But chronic cough all the time is a big one. Chronic mucus all the time, big one. And so it looks like you basically either have a cough or an upper respiratory infection. Bloody noses, huge. To me, if somebody's like, oh, I get chronic congestion and bloody noses all the time, I'm like, we got to test your house. We have to test it. And this goes in with the person saying their father has COPD after going into the moldy basement. What you need to do is test, right? If I'm trying to convince someone that there's mold in their home, we test. Hey, like, look, the plates, they're $34 for the set of 6. Like, come on, like, this is not even lunch. Let's go test your house and see. And sometimes it's a little convincing to even get them to do that. But if you can show that there's mold there, boom. I mean, case closed. Now we know what we got to do about it. So if there's a mildew smell everywhere, you got mold. I mean, no doubt, right? Okay, so from that front too, then you've got to navigate the next conversation of what to do about it, which could be some self-cleaning. And we do have a free guide to that on our website, Keystone Total Health, if it's small. But and so that kind of goes along with the microbalance, EC3 fogger, and things like that. But if it's major and extensive, you do need to seek some professional help. Okay. So if we've got our mold numbers down, I'll answer this question because it deals with homeopathy. Can we start homeopathy? So you can use homeopathy while you're working on the mold. That's no problem. It just depends on what homeopathics you're using and to do what. So this will be a good segue into the next question. What interventions have I seen work the best for most people? And so I've got a stepwise process I use, right? Step 1 is test your environment, test yourself for mold. If it's positive, remove yourself from the exposure as much as possible. And so that might mean cleaning your environment, moving out for a little while, whatever. But phase 2 would be slowly open your detoxification channels to clear the mold toxins and bind them up. So I use homeopathics for that phase as well sometimes. They might be drainage remedies to help get the lymphatics drained, to help get the liver, kidneys, colon, bladder, all draining, right? So when we're moving things, it's got to drain from the cells into the bloodstream, into lymphatics. Then it's got to drain from the lymphatics and blood into the liver, kidneys, from the liver and kidneys, it's got to drain in the gallbladder into the colon, right? Or from the kidneys, it's got to drain into the bladder and urinate out. And so those homeopathics can gently help to open up drainage. They can start to help get us moving and get those mycotoxins cleared out. You can also use homeopathics to help lower the inflammatory response, support healthy inflammatory response to mold toxins. Okay. Yeah, just as people are talking about remediation costs, they vary widely, right? It can be pricey. Just make sure you go with a good company who understands mold illness. If somebody says, we're just going to spray it once and call it good, and you've got a mass amount of mold, you might want to look somewhere else, right? So the products are pet friendly. Typically, when I'm fogging extensively, you'd want to have people out of the room, but it's okay. Everybody's gonna get cold and wet and stuff, but they are pet friendly, child friendly, etc. So step 1, test, get out of the exposure if you can. Step 2, open up detoxification, bind up the mold toxins. Binders are huge. If you're in mold, you got to be binding. You might need to use a more gentle binder than others, but you got to be binding the mold up. There's lots of options on that front, and they do different actions. Different mycotoxins are bound by different binders. Just generally, charcoal binds most of them, right? So, and it's usually a little gentler than some of the other ones, but you got to find which one works for you and which one works best. Working with a good practitioner helps, okay? Especially if they can do some sort of biofeedback testing on you to pinpoint which one's going to work best for you at which time. Step 3 is lower the inflammation and start supporting the body's terrain. And so that's kind of what I'm saying there when I'm talking about drainage, maybe supporting a little bit of like general detoxification. We're just maybe like getting some minerals and electrolytes right, just a very general supportive setup, but then also trying to directly lower the inflammation. So one of the other terms for chronic mold illness would be chronic inflammatory response syndrome, because every time you get exposed to mold, you're having an inflammatory response. Mold exposure, inflammation, right? Chronic inflammatory response syndrome. So we want to lower that inflammatory response. One of the markers we use to look at that is complement C3A, C4A. Those are immune markers. Those are typically pretty elevated in folks with mold illness. So there's lots of different ways we could do that. Again, we could use homeopathy. I use herbal medicine. We might use some different supplementation that's anti-inflammatory. Diet's going to be a big part of that. If you have mold illness, mold exposure, chronic inflammatory response syndrome, you got to get gluten out, right? You can measure anti-gliadin antibodies, which is basically is your body attacking mold and having attacking gluten and having an inflammatory response. So you got to get that stuff out. And so get gluten out of your diet. Typically it works well for a short period of time to go low carb if you're dealing with it, because it helps lower that inflammation for a little while. Okay. Yeah, so somebody asked a good question. I'll explain about difference between active mold, mycotoxins, and immune response. I'll talk about that a little bit. It's one I try to cover a lot. So lower the inflammation. If infections are involved, then we need to support the body's immune system next. That's step 4. Okay, so a lot of times mark-ons and sinus infections come with mold exposure. So what happens? We're breathing in the mold. It's irritating our sinuses, right? So the mucous membranes are more sensitive, and it's lowering our immune system. It lowers your immune response. And so now all these opportunistic infections can settle in our sinuses. Some of them being mark-ons, which is like an antibiotic-resistant staph. I've seen strep. I've even seen E. coli, right? You can even have just fungal overgrowth itself, aspergillus, all sorts of different stuff can grow in there. And so we need to clear those infections out of the body. If there's a mold overgrowth, and this is a good segue. So somebody says, is there active mold growing in your body, right? You could have a fungal overgrowth from being exposed to mold spores for so long. So we may need to clear that. I don't do that early on unless it's certain cases, right? Because we need to make sure you can detox it out first. That's why step 1's get out. Step 2 is to open the detox channels. And step 4 ends up being dealing with the infections. So you need to distinguish that. Is there active fungal overgrowth? The number 2, are you dealing with mycotoxins? And a mycotoxin test to help you tell that. And so those can be wherever. They can be stored all over the body, okay? And then number 3 is like, are you allergic to mold? And so you can have a mold toxicity, a mold infection, and a mold allergy. And you have to address each one of them differently, right? You have to address them specifically. And so there's different ways to do that. Using my steps here, my 7 steps addresses all of them depending on what you're dealing with. Okay, so if infections are present, support the body's immune system. Lowering inflammation is going to help with the allergies. Supporting the immune system is going to help with allergies, the infections, etc. So then you want to start dealing with specific issues caused by the mold. So this might be like the low ADH. So at this point, this is when I might introduce something like cell-tropin. I might be supporting directly, like repairing cell membrane function, repairing the brain, damaged intestinal membranes, right? Whatever the mold caused, the direct issues the mold caused, we want to start supporting and handling that here. Okay, that's that step. So that would be step 5. Step 6 is you need to start retraining the brain and the limbic system. Mold causes inflammation in the brain and limbic system. It creates this constant threat environment, a constant potentiation of stress on the system. And so sometimes our limbic system, our threat response system in our body takes over, and it exacerbates these responses. It exacerbates our symptoms because it's going, this is dangerous, this is dangerous, this is dangerous. And so it's saying, have a big inflammatory response, have a big inflammatory response, try and get it out, try and get it out. And even me saying it like that's probably a little stressful for you to hear. And so we need to retrain that so that our brain and body can have the appropriate response to the stimulus, right? We don't want to have too little, and we don't want to have too much. So retraining the brain helps us meet in the middle. Okay, so there's variations, things I do. A lot of times I'll make a custom program for people to brain retrain, maybe a variation of tapping or parts work or maybe some mantra repetition, whatever works best. On that front, there's great systems out there, Gupta and DNRS to look at, but you need to retrain the brain and limbic system. And then finally, the last step, step 7, and this is when you've gone through the other steps, and sometimes the steps are circular, right? So we might not be just be layers. Do this one, then stop. Do this one, then stop. Sometimes we got to keep doing them a little bit, right? So you might be able to lower your detox support while you're focused on inflammation, but you still might keep doing a little detox, etc. So, but you want to build a mold tolerance. We want to get you the ability to go back out into the world again and not have to stress about being exposed to mold. Now look, if there's mold growing all over the ceiling somewhere, that's not good for anyone. Okay, but there's small to moderate amounts of mold in the world that we want to be able to get exposed from and not have a total crash. So for instance, one patient I had with mold illness and Lyme disease, when she was exposed to mold, it'd be a seizure and then she'd be out for 3 days, stuck in bed. Okay, body pain, aches everywhere. A lot of times couldn't walk, had to go in the wheelchair. So moderate to even low exposure, seizure, out for 3 days. You can't live a life like that. Okay, and now she can go into moderately mold environments and she can be in there a few hours and have no problems. If she's in there extended period of times, she might start to get like a little bit of asthma-y and some congestion. She just cleans it out. She does a procedure we put together for protocol for if she got exposure, and she's good. So she's built up that mold tolerance. We helped her build that mold tolerance again so she can live her life again and it's not such a major exposure. Okay. Okay, somebody said they're confused. Do I start with homeopathy and cell-tropin? Okay, I can understand that confusion. Cell-tropin is a homeopathic remedy, okay? So there's lots of different homeopathic remedies out in the world. You can really technically turn anything into homeopathic remedy. You could even grind a computer up and turn it into a homeopathic remedy. I'm not sure what that would be good for, but you could do it, okay? And so cell-tropin is a homeopathic blend that we use. And so I don't start with cell-tropin, but I do start with other homeopathics. Cell-tropin, a lot of times I will put in stage 3 or 4, okay, of my 7-step process there. And then I might start with other homeopathics earlier that maybe support detox or like drainage. Can it smell like feces? I think you might be asking, can mold smell like feces? It can smell pretty terrible. A lot of times there might be other things in your sinuses too that are making, or there's other, like sometimes with mold, often it goes along with mycobacteria in our environment and other types of fungus that can create some pretty nasty, terrible smells. Yeah, so here's a great statement. This guy's talking about his dad's basement. His vision became pixelated. When neurotoxins get in our brain, one of the first things that affects is vision, okay? So when the mold toxins affect us, the mycotoxins hit us in the brain, they'll strongly affect vision. You can actually do different neurotoxin tests that are visual tests that they find correlate quite strongly. Okay, so there's a couple other questions I wanted to get to. Let me pull those up that were great. Okay. I think I answered that one. So is a near-infrared sauna an effective addition for mold treatment protocol? Typically I would start with far infrared. You don't want to use too much near-infrared all the time. You want to take breaks from that because the effects as on the body. But far infrared is a great way to detoxify, get drainage out, get the blood flowing, all those things that are affected by mold. Just make sure you have a proper detox protocol in place, okay, before you start doing something like the infrared sauna. But it is a great way to open up the detox channels. It's one we use heavily here in the clinic, use in our home. It's one of the top things I recommend patients get for their home for detox products. There's a lot of great home saunas out there. How accurate are over-the-counter mold test kits? I can't vouch for any kits except for the ones I use, right? So I can't vouch for the ones you get off of Amazon. I can't vouch for the ones you get at the hardware store. But I'll tell you, I've done multiple types of mold testing, and I've found that the EC3 plates are very accurate in my experience. They do a great job of telling us, is there mold showing up? How does it correlate with other mold tests, okay? Okay, so that one, is Aspergillus black mold? Okay, most people, when they're talking about, different molds can be black, okay? But typically when people talk about black mold, they're talking about Stachyboitries, which is one of the most toxic forms of mold. Aspergillus is not Stachybotrys or different types. Aspergillus can be pretty nasty though still. Creates a lot of mold toxins. It can actually infect us as well. And it's typically from water damage. So black mold and the scent of cat urine connected. It can be, but a lot of times that scent of cat urine means ammonia. And so while whatever the fungus, the mold, black mold is breaking down, it could be creating ammonia in the process because molds are their breakdowns, right? They break things down. That's what they're doing. And so whatever they're breaking down could be producing that ammonia a lot of times, which is creating that cat urine. Okay. So how do you know when you're truly healed and mold-free? This is a great question. Okay, so when you're doing a treatment protocol like my 7 steps, right? You're testing your environment, opening up detox, you're lowering inflammation, clearing infections, dealing with specific issues, you're retraining the brain, and you're building a mold tolerance. Well, number 1, you can test, right? Are the mycotoxins going down in my urine? Okay, that's a great indicator. Number 2, you could do the different neurological tests I talked about, the visual tests, the VCS, visual contrast screen, to figure that out. You can start to measure the different markers. Are the inflammatory markers in your blood going down? Are C3A and C4A going down? Are your hormones normalizing? ADH and MSH, are they balancing out? Is your osmolarity improving? Like, is your hydration improving? And then we can just look at symptoms. Are you symptomatically improving? That's going to be huge. And then we do further testing, like we do biofeedback, muscle testing, things like that are other great ways to do that. And so those are great ways to look at it. You know, test, don't guess. Okay. I don't want to have people spend tons and tons and tons of money on testing. I like to hone in on the tests that I think make the most sense so that they can focus on getting better. But you also want to make sure you're tracking progress, right? So test, don't guess. Test along the way, see what's going on. So if somebody asked about ozone treatment at the house, and kind of like I said earlier, fogging and ozone are complementary but kind of work differently. But again, test. Get some mold plates. Is there still mold growing in the home? On a nonverbal child, I'm guessing you mean something like they've got a neurological condition, maybe autism or something along the lines, who's nonverbal. I am sorry to hear that. I know that's tough to deal with. They are very typically mold sensitive because of how much inflammation is causing that neurological issues. So you want to make sure you're out of the moldy environment as best as possible, or at least you're keeping the mold levels down. And you can test, right? The mold kits are affordable, so continuously test. Typically, ozoning once won't do it. That's just been my experience. Okay, let me look here at the next round of questions. Should all people do antifungals if they've been exposed to mold? Not everyone needs to do antifungals because you may not have fungal overgrowth. Antifungals kill the mold. And so, like for instance, EC3 Microbalance offers a Citradrops nasal spray, great way to clear fungus and other infections out of the sinuses or support the immune system in doing so, right? And so, so a lot of times I do recommend nasal sprays for a lot of people, especially when our tests, our thermography, and our biofeedback scans show chronic sinus infections. We'll do nasal sprays. But anytime I find somebody has a mold exposure, I want them using a nasal spray to clear it out. Okay, but do they need to clear everything with antifungals? No. If you don't have fungal overgrowth, there's not a ton of point to treating, like doing like an oral treatment for antifungals if you don't have a fungal overgrowth. If you have mycotoxins but no fungal overgrowth, antifungals won't do it. You just need to focus on detox, etc. So hopefully that's helpful. I had direct mold absorption through the skin last October. I had testing, newest levels of mold found. A year later, I moved into a clean environment. Fatigue is improved, but now with alopecia. So this is really great. So for me, and I say that it's not great you have alopecia because I've dealt with it. Alopecia beardata. When I have a big mold exposure, I get bald spots in my beard. And I was recovering from a mold exposure years ago. A couple of times I've had it happen, and it looked like I had somebody ask me once, did you shave a bald spot in your beard? Because it literally, like almost a couple inches, blew up into a bald spot. It's called alopecia beardata. And so what that is the mold is essentially cutting off blood supply to those areas. It's affecting blood, and it's also creating like an autoimmune type reaction, essentially. At least that's what I found. Okay, so make sure you're detoxing the mold yourself. But the key on that front is you have to deal with the inflammation and you have to deal with the immune response to the mold. Okay, that's been my experience there. And then the hair grows back. A couple other things you can do. Brush the area quite a bit. Get a lot of blood flow in there. Just use a hairbrush and brush the area. Brush it, whatever. Get a lot of blood flow to those areas. But you got to make sure you're working on the mold, all those steps, right? Am I detoxing it? Am I clearing the immune side effects? Am I lowering the inflammation, etc.? What do I think of the Shoemaker protocol? Shoemaker's amazing, okay? He's a pioneer in this field. He's great. Just like everybody who helped create Microbalance, like fantastic guys in the field. He's got his protocol he seems works. I don't agree with all of his medication recommendations. I don't find that a lot of times they're hard to tolerate or they don't test well. They cause other effects. But overall, his protocol makes sense. I go about it slightly differently in a slightly different order, but his protocol makes sense, right? He's a pioneer in the field. He's great. Is there a brand of homeopathics I recommend? Well, for sure, I use Microbalance and EC3 for the homeopathics they have. Those are fantastic. And the other ones just vary. And I do make some by hand, right? I do some hand dilutions. I am trained in homeopathy, and so I do some hand dilutions. But the biggest thing is you just want them to be a reputable company and you want them to be a clean product, right? So that's the biggest thing of looking at a good homeopathic brand. Derm doesn't seem to know how to manage alopecia. I kind of touched on it a little bit, right? Clear it out, manage the inflammation, manage the immune response, the autoimmune tendencies, and then stimulate the hair follicles, right? Stimulate the skin, get the blood flow going there, etc. What's a good binder for gastritis? So, it depends on what's causing the gastritis, etc. A lot of different binders are going to have different effects. Clay is going to bind certain things. Charcoal is going to bind other things, but charcoal and clay are traditional remedies for gastrointestinal issues, but it just depends on what's causing your gastritis. So you want to look at things that are going to soothe the tract and bind up what you're dealing with, especially if it's fungal related. You want to make sure you're binding up the right mycotoxins. Okay, scrolling down here as we're getting in. We're doing great timing, guys. What about clay as a binder? Yeah, I kind of touched that. Bentonite clay, different types of clays make for good binders. So some different binders I use, right? I use activated charcoal, carbonized bamboo, humic and fulvic acid, which is also known as bioactive carbons. I'll use Saccharomyces boulardii, even some different things like colostrum and IgG powder can be good binders. Beta sterols, fiber, pectins are all going to be great binders in that front. Bentonite clay. You got to realize each one binds up different mycotoxins, and so you might have to alternate, you might have to rotate. And a lot of times that does best for people is rotating maybe a month on this one, a month on the other one, or 3 days a week on one, 3 days a week on the other, etc. So lots of different binders that have different effects on different mycotoxins. Have I seen Hashimoto's reversed after removing the mold source from the body? If the mold was what was causing the Hashimoto's, then yeah, I've seen a lot of things get reversed. I've seen dementia reverse when we cleared mold out of the brain. I've seen different gastrointestinal diseases reverse, autoimmune conditions, which Hashimoto's is an autoimmune condition, reverse. I've even seen Lyme disease get better with minimal treatment once the immune system kicks back on, once we dealt with the mold. So it's a fantastic way to do it, is making sure what's causing it, right? Test. What's the cause? Clear it out. Follow the procedure. Alopecia, talked about that one a little bit. So yeah, I will make sure I save that one. It's great. So I'll say, Kathleen, you're talking about, has anybody had new hair growth? You can see some of my old videos where I was out of the mold exposure but still healing, and I had massive holes in my beard. Okay, and now you can see I've got my beard back. And so it comes back, it does. And I have lots of patients who their hair comes back in, new growth sprouts, etc. But you got to make sure you get the mold toxins out, support the immune system, deal with the inflammation. Best time of day to take a binder. Okay, so best time of day to take a binder is whenever you can get it in, number one, right? We want to be practical. But number two, so you have to understand detox, okay? So when you're detoxing the mold, it goes to the liver, and then it goes into your gallbladder, which releases bile. So bile is both a toxin dump and it digests our fats for us. So when is it going to be released? During meals. So when you eat, you start chewing, the food hits your stomach. Your stomach triggers your gallbladder to release the bile into your intestines. So if you take the binder before you eat, the binder's in your intestines, and then it can bind up the bile that comes out, the mold toxins. So if I had it perfect, you should take your binders before meals. That would be best. So best time of day. Ultra Binder by Quicksilver is also a good binder. It is. It's got a lot of different things it covers. Good binder. How to clean house after remediation. What should you throw away? Who can you get to do cleaning? There's lots of different cleaning remediation companies out there, maybe even some potential like just straight cleaning services that specialize in mold. You want them to make sure they have a mold background and more so a mold illness background. So it's not just is the house good or not, but is the house safe or not for you? And then, at that point, you want to make sure you're using a HEPA filter on your vacuum. You're using an air filter that's got a HEPA air filter. You're changing your HVAC filters on a regular basis. You're getting some Microbalance EC3 cleaning products, the wipes, the sprays, the laundry additives, such as lowering mycotoxin load. Hopefully, whoever remediated your house used air scrubbers, used reverse airflow, wiped created plastic barriers. I hope they did that. What can you throw away? What can you keep? Test. Number one, if you've got fabric things, test it with the EC3 mold plates. That's what I would do. But number two, anything with fabric is going to be harder to clean. That's just anything porous, right? Something wood with a coating, it's going to be easier to keep than like a fabric piece of furniture. And then metal is going to be easier. So you got to think like, where could the mold get into and stick? But test. Use some plates and test and see what you can clean and what you can get rid of. And there's some different charts out there that have different experiences on that front. But basically, can you clean it? What do you recommend use for nasal congestion? So Citra Drops EC3 makes a great nasal spray that tests well for a lot of patients. You can do different sprays with essential oils or different types of like nanoparticle silver are great options there on that front that I use often. Sometimes I'll tailor some things. Like I might start with a base of like Citra Drops and then test and add a few things to like essential oils to it that test best for a patient, or I might do something like that. But those are some great options there. How do we work with you? I'd like to get some screening done for my toddler. Yeah, so you can check out KeystoneTotalHealth.com is a great way to look. There's a link in order to book some consultation with me. You can read some of the blogs. You can also check out the blogs I write on for Microbalance and Cytosinus Wellness. But you can reach out that way. You can reach out over Instagram as well. How do you rid Marcons in the sinuses? You got to deal with it directly. Number one, clear the mold out of the body so the immune system can turn back on, support the immune system. Right, would be number two. Number three, have the body clear it directly. Nasal sprays. Got to do them. All right. Have you seen elevated liver enzymes in, I think you're meaning people who have a mold hit or exposure? For sure. Especially if they're poor detoxifiers. It can raise the liver enzymes, no doubt. Is a little mold in a home harmful? I don't know if I need to get rid of everything. So on the EC3 plates, they give you a little scale, right? A couple of spores, probably not a huge deal. If I saw a couple of spores, I'd say, all right, let me get some air filters and do some fogging occasionally, right? And so you can see kind of levels. How many spores? What's the spore count growing? So that would be the biggest one. I don't know if I need to get rid of everything. Test it out. What do you need to get rid of? If you can't clear the mold smell, if you do the tap test with the mold plates, right? And you can't clear out the mold counts, well, that's when you need to get rid of everything. But test and see. Sometimes people they'll air it out for a week or a month in the garage, bring it back in. Do you react to it? Do you have an inflammatory response? It's got to go, right? What to do about hypersensitivity wheezing? I've been dealing with sears and have vision issues as well. Yeah, I mean, all those things, vision issues, chronic inflammatory response syndrome, hypersensitivity, something kind of almost like asthmatic wheezing or allergy wheezing, can all be caused by mold. So you follow the steps, right? So what are the steps? If you're living in it, try to get out of it or limit your exposure. Start detoxifying. Number two, lower your inflammation. Support your immune system. Deal with the specific effects, right, of the mold exposure. Retrain your brain. This is a definite step. If you're dealing with mold illness, retraining your brain is a major step that you need to work on. And number three, building a mold tolerance, right? Rebalancing your immune system so you can create a mold tolerance. That's how I would deal with those things. Have I seen patients with ALS improve after treating for mold? Okay, ALS is a biggie, right? Neurodegenerative disease. I've worked with a lot of patients with ALS. Here's what I've seen. If you're supporting the body, especially if you're supporting those 7 steps I showed you, I've seen them improve. Okay, I've seen those cases get a lot of functionality back. Now, I would never say I'm treating ALS directly, right? I'm supporting the body. The body's amazing. It's got that innate intelligence, the wisdom inside that knows what to do. So you support the body. I've seen those people get strength back, energy back, less fasciculations, right? Slow progression, all those sort of things. So if you're dealing with the cause, and mold is one of the causes, then I've seen those cases improve, and I've worked with those cases directly who part of the issue for ALS for them was neurotoxins from mold. So yes. So if topical steroids along with basically Rogaine is good remedy per the dermatologist. There's some toxic effects from some, like the Midaxonil. There's some toxic effects that could happen. You definitely don't want to take it orally. Okay, if it's left topically, maybe the toxic effects could be minimal, but you got to ask, are you dealing with the root cause? Now, maybe those things on the back end might be helpful. I would say in the long run, steroids are going to suppress your immune system. And so a lot of times what I'll test for someone with alopecia, they've got topical fungus. There's fungus growing on the scalp. So you need to deal with that directly. If you just suppress it with a steroid, you're just going to drive it in deeper. It's going to be a constant problem. But those could be some short-term solutions, okay? And so use them appropriately, recognize the risk-benefit ratio, and then decide from there. Binders won't bind nutrients if taken before meals. Depends on the binder, right? Certain binders do bind nutrients, some don't. It's not going to have such a binding effect that you're going to, create a massive deficiency. But you take them half an hour before your meal. And that has time to bypass the stomach so it can sit in the intestines. And then when you start eating, your stomach closes, right? The bottom of your stomach closes and stomach becomes a sac. And so the binder's already passed through it. And then the food gets digested. And so you're basically beating the chase. Binder nutrients, right? And so take it half an hour beforehand. But don't stress yourself out. Don't drive yourself crazy trying to make that perfect, okay? Propolis nasal spray effective. It's good at helping clear infections. I've never found it to be enough alone. Just at least for mold illness, okay? But it's good for like viruses and bacteria and stuff like that. Could mold illness cause vertigo and dizziness? No doubt. Seen it all the time. Could cause posterior orthostatic tachycardic syndrome, POTS. So that can cause low blood pressure, dizziness, right? It can affect the brain. It can affect the upper cervical apparatus. So for sure, I can see it cause dizziness. How long can someone hold on to mold? I've seen them hold on to it for years if they're poor detoxifiers or if they have the HLA gene, right? They call it the dreaded mold gene. You can hold on to it for years if you're not dealing with it directly. If you didn't know you had it, yeah, it can be in there for years. Okay, we're getting close here to the hour. We're doing great, though. I'm going to keep going until 8 o'clock, so I'm just going to keep answering as we go. So this first thing you just mentioned. What additional recommendations do you give to those who have the mold gene affected by mold? Same thing, right? They follow the 7 steps that Gala was talking about earlier, who she'd have a mold exposure, seizure, 3 days in bed or in a wheelchair, right? And now she can be exposed to it for mild to moderate amounts of mold for certain periods of time and be okay. You support the body, right? You clear the mold toxicity out, you lower the inflammation, balance the immune system, support the specific effects, retrain the brain, and rebuild the mold tolerance. Now look, if you have the HLA gene, you're still going to be more susceptible to other people to mold illness. So you probably need to be a little more careful. And so what we did for her is like, okay, we built an exposure protocol. Mild exposure, maybe no big deal, don't worry about it. Moderate to large exposure, we're rinsing the sinuses out, we're binding up the toxins. We're doing that for maybe 3 days, okay? So, but the general, this is a good time for me to address this in overall. Like, I don't like cookie cutter approaches. You're not going to get the same protocol from me overall. Like, we got to have basic protocols to give everyone, okay? But the general idea is what's going on with you and deal with what shows up, right? What do I find? Deal with that specifically, okay? So you gotta understand what's going on with me and am I dealing with that specifically? So if you have the HLA genes, what else is showing up? Which genes do you have? What else is bogging them down, right? They're not totally gone. They're just low functioning. So we just need to support them and figure out what's bogging them down. So do you retrain your brain with psychological therapy? I mean, therapy could be helpful, right? And I would never say what I'm doing is psychological counseling, but I am supporting psychological health. I'm supporting neurological function. So whether that's with tapping, whether that's with parts work, whether that's with mantra work, affirmations, different brain or functional neurology, retraining exercises, but therapy can help, especially if you're dealing with trauma. Trauma is going to make your body more reactive to everything. And look, we don't, oh, this is just mental. No, we are a mind-body apparatus. The mind and the emotions and the body all work together. You cannot separate them out. Okay? Get that out of your head. You can't separate them out. So if we're doing something psychologically healthy, it's supporting the body being healthy. We're supporting the body being healthy. We're supporting the psychology being healthy. So if you have a lot of trauma in your background, complex PTSD, any of that, especially at that point, therapy could be really helpful because you would lower those trauma episodes, which and then is going to create more psychological health. It's going to create more brain health. It's going to create more body health. Okay? So people with CPTSD tend to have more inflammatory reactions, more hypersensitive reactions with like things like histamine, because histamine is a stress hormone as well, with MCAS, things like that. And so you need to address the trauma. Yeah, limbic brain retraining, exactly. Yeah, thank you, Catherine. So happy to be helpful on that front. You're welcome. Okay, we got about 5 minutes left. Let's see what's coming up here. Any suggestions for continued irritated eyes, dark under eyes, long-lasting? Yeah, so dark circles under the eyes, a lot of times are going to be mold exposure. You're probably still getting exposed. Blood sugar issues, or you don't have enough antioxidants. You got too much free radical damage. Continual irritated eyes. What that tells me is your mucous membranes need healing. Are you hydrated enough, right? So you might be drinking enough water, but we can look at the mold effects on ADH hormone. Can you retain your water? On osmolarity, do your cells retain the moisture? So we're looking at those things. We might need to repair your cellular membranes and your mucous membranes. So we might need to look at things like phospholipids, CoQ10, vitamin C, things like that, collagen, special fatty acids. So are we repairing the cellular membranes? So these are all cellular membranes that can be irritated by the mold toxins and fungus. And so if we haven't repaired them, even if we're out of the exposure, they might still have a problem. So get out of the exposure, detox it out, repair the effects. We just got a mold and all 3 of my children got a rash after we left. Is this related to the mold? Why would it come after we left the moldy environment? Because you're no longer getting exposed and the body says, oh, now I can finally deal with it. So it might be having an immune effect. So the immune system may be kicking back on and creating like immune effect, or you may not be detoxing enough. You got to make sure you're detoxing it as well on that front. So the skin, there's 4 ways to get toxins out of the body, right? We can poop them out, we can pee them out, we can breathe them out, or they come out through our skin. And so if we're having trouble removing the toxins, a lot of times rashes, acne, pimples, blisters, it's a detox reaction. It can also be a histamine inflammatory reaction, but it's one of the main ways we detox. So we know that's happening. They're probably not detoxing it out well enough. You need to help them detox it out. Okay. Scroll down a little bit, see what's going on there. What's the nasal spray you recommend then? Citra drops are great. From citrus spray, from EC3 Microbalance. They make a great nasal spray. It can cause eye floaters also. Yes, it can cause eye floaters, anything that's going to inflame the optic nerve, the vitreous fluid, etc. I also find Lyme, toxins, bacterial infections, parasites can all cause eye floaters. But yeah, definitely causes eye floaters. Do you need to throw away books and pillows? I'm a total bibliophile, right? Love books. We have so many books in our house, in our home. And so sometimes you do though, right? Paper, it's porous. And so what you do is you take it out of the environment, you can treat it, you can fog it, you can ozone it, you try to let it air out, and then you see how do you react to it. But you definitely want to give it a chance to air out. Pillows, usually you can try washing them in some of the laundry additive from EC3, but a lot of times pillows gotta go. Can you detox from mold while pregnant? Kim, you'd want to be really slow and gentle. I would highly recommend, educational purposes only, but finding a binder that you tolerate really well so that the baby's, you're binding up as much as you can, and you're just being really slow and gentle because you don't want to drive anything out of your cells that are stable, okay? So at that point, I would say like mostly on that front, when I have pregnant patients like that or clients, I'm looking at let's stabilize the body, get you out of the exposure, and focus on binding it up. I don't want to drive too much out. I just want to clear the cream off the top. So like when we cook or whatever, right, the cream rises to the top. I'm not going down looking for it if you're pregnant. We're just going to clear it off as it comes up. Bind it out and just gently clear it off, okay? Because you want to protect that baby at all costs. A lot of times, toxic women will feel better when they're pregnant. Unfortunately, it's because the baby gets the toxins. So you want to support clearing that cream off top as much as you can. It's doable, okay? I want to make sure I'm giving you some hope and confidence there, optimism. It's doable, and you can protect that baby. Just make sure you're focusing on support, lowering inflammation, and just clearing the toxins as they show up. Don't go digging them out. Any way to clean a bed. It's tough, right? It is tough to clean a bed. I would essentially do this. Vacuum it, fog the snot out of it, especially with the electrostatic fogger from EC3, from Microbalance. Fog the snot out of it, let it dry, HEPA vacuum it, fog it again, do that a few times, and then I would seal it under a mattress cover. That's what I would do. Can you pass mold onto your children? Sorry if that sounds stupid. Yeah, kind of like I said, if you were pregnant and you had a bunch of mycotoxins, that baby might pick up some of those mycotoxins while you're pregnant. They can pick up heavy metal. They can pick up other toxins for sure. If you have like a fungal infection, they could potentially pick that up during the birth or whatever too as well. Big one too is they just may pick up your genetic mold susceptibility. Yeah. I want to make sure I say, because a lot of mamas get really guilty and shameful, right? That they feel like they poisoned their kids or they made their kids sick. That's not up to you, right? I have no doubt you're doing the best you can. And so don't take that burden on yourself. And when you discover it, you just do the best you can, and that makes you a good mama, okay? Don't take that onto yourself. Okay, guys, I'm going to answer one more question. Let me scroll down and see what we got. I already talked about books. Talk about frequent urination, right? Follow the steps, especially treating the brain. Salt, 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 salt. Himalayan, Celtic sea salt, really great there. Happy to cover so much. Happy to do it. For Jana Citrodops, okay, people with MCAS, just make sure it tests well for you. Okay, the last one, penicillin, a lot of times mold, water damaged buildings, under sinks, fridges, things like that. Okay, I'll answer the car question last. I'll answer these two questions. I'm just a sucker on that front. Okay, is there any help for a car that got cross-contaminated? We had a detailed ozone and I still react to the car. Deep cleaned on the front of like HEPA vacuumed and fog the snot out of it. Fog. I would get all the nooks and crannies fogged as best you can and then re-HEPA vacuum it, okay? That's what I would do in the car and then retest. Can you get it cleaned on that front? Can you clean, save photographs? Those are tough. Put them in sleeves, right? Ziploc baggies, whatever. Plastic them up. That's what I'd recommend on that front. So that way you can still look at them, you still go through them. And that you can do that papers and things like that you want to save. Ziploc baggies, put them in sleeves. Trap that, seal it in. And if you're going to be around it, you're going to go through a whole box of photographs and maybe you're going to get exposed. Wear a respirator or N95 mask, something like that. Help protect you as best you can. Fog masks, those are all great. You guys, thank you so much for hanging out with me today, hanging out with the Microbalance team. Thank you to the Microbalance team for having me on. I hope this was helpful. I'll save the video at the end, and so you can recap it later. So you can check Microbalance out at their Instagram handle at Microbalance Health. You can check me and my team out at Keystone_Total_Health. Keystone Total Health is us, or you can look us up on that front. Again, I'm Dr. Martin Hart. So glad to get to chat with you tonight. Share this if you found it useful. Continue commenting, and you all take care.